Guys, what's going on? Welcome to another video on my channel, Hairliciously. Make sure to subscribe if you guys are new to this channel so that you guys are updated on my second hair transplant journey progress, as well as video topics covering current hair loss treatments in the pipeline. Check out my website at hairliciously.com to follow my current hair loss treatment regimen, which includes microneedling and dermarolling, which is scientifically proven to stimulate hair growth, my DHE blocking shampoo and serum, low-level laser therapy cap, and my hair growth vitamin supplement. So today actually marks my 56th day since my last hair transplant. For those who don't know, I actually got my second hair transplant November 11, 2019 to be exact. And it has nearly been 2 months since my second procedure. So let me start off by showing you guys the hairline. There's a bunch of tiny vellus hairs that are growing in various areas, all throughout the hairline. A lot of them are very thin and wispy, and they're going to eventually get thicker and thicker as the months progress by. But as you guys can tell, there are still areas that are just empty. Eventually, the hair follicles are going to start emerging. But like I said, I'm only like 4 days away from my second month. So I'm still in the early stages, and most of the hairs that were implanted are still dormant. And that's why you guys don't see a lot of the hairs that are growing out. Most people are going to start seeing hair growth around their 3 or 4 month mark. So it's really all about just being patient. And as I mentioned before, the hardest part about a hair transplant is the whole waiting game. And it can take upwards to almost a year to see final results. Now, redness is still a little bit present, but as days are progressing by, it's actually getting lighter and lighter. And hopefully by my 3rd month, you guys won't even be able to see any of the redness. Obviously, the lighter skin that you guys are, the longer the redness is going to last because of the contrast with your skin. There's actually no more numbness on any of the recipient and the donor zone. And I did have a couple pimples actually on the recipient area, but I ended up popping them and it resolved after a few days. So there's no problem there. This is commonly known as folliculitis, and actually it's pretty common for those who actually had a hair transplant. And folliculitis basically is inflammation of the hair follicle on the scalp due to various causes. But some of the more common causes is because of the blocked oily pores, especially when the area is not thoroughly cleaned. A lot of people are scared of still damaging their hair follicles even after, a month or 2 after the hair transplant. But it's very important that you guys actually clean out the scalp to get all of the debris and all of the oil. I actually had folliculitis during my first hair transplant, but, also I didn't have any issues back then. I still do get itchy scalps, especially in the donor zone, but it still seems to be getting better day in day, and it's not as itchy as it was a month back. And I don't have to, rely on antihistamines to stop the itching. There's also itchiness on the recipient area from time to time, but this seems to be a common thing. And one of the reasons is because a lot of the hairline and the scalp in the front of the hairline is going to get very dry and scaly around the 2 to 3 month mark. And you guys can use something like Nizoral, which has the ingredient ketoconazole, to treat the dryness and the flaky stuff on the hairline. So apparently I bought this hair massaging comb, which apparently helps remove all of the debris and dirt and oil on the scalp. And I should be getting that sometime in the mail this week. And based on the reviews, it really works well in treating dandruff, flaky scalp. So once I get the product, I will be doing a review on that. And also from time to time, I actually use my USB microscope, which magnifies anywhere from 10 to 40 times to, just go and analyze the scalp just to see if some of the hairs that I'm not able to see are indeed growing. And so I'll also do another video on that where I will show you guys the condition of my scalp. And I'll do like a before and after using the scalp massager, and just to show you guys the efficacy. The nice thing about the microscopes is that it shows you, some of the areas that you're also thinning. So you can easily compare some of the hair shafts in thinning areas like in the crown to some of the other areas where you actually have normal density hair. So if you're suspecting, hair loss in the temples or in the crown, the USB actually might be a very good tool to help you diagnose or confirm that you are indeed thinning. But let me tell you this, guys. People who've had hair transplants really need to do a good job cleaning their scalp. A lot of times our nails, aren't going to get down deep into the scalp. And being that we also are afraid of damaging the hair follicles, we don't wash our scalps enough. Or we actually don't wash it thoroughly. And this is also the case for people with longer hair. Now, there are times where I just want to buzz cut my hair just because it's going to make everything easier as far as cleaning and maintenance. But I still have to wait a few months until the hairs grow in, especially on the hairline, so that it's going to look more uniform. And I also need to do SMP after buzzing to disguise the FUE scars. You know, you guys probably won't realize this, but over the span of my 2 hair transplants, I literally have about 3,500 holes in the back of my scalp. And with 3,500 holes, it's going to be somewhat noticeable no matter how well the doctor extract the grafts. And so in a few months, I'm actually going to be looking into a good SMP place where like I've mentioned before, I'm going to consider also getting my license to practice SMP, so stay tuned for that. Anyway, guys, this is my update for day number 56. Just another quick look. That's the right side of my temple, the frontal portion of my hairline, and then this is my left temples here. So far, so good. As you guys can tell, it's really framing the face, and hopefully once everything grows in, I can just go ahead and just put my hair up, and I don't have to worry about anything like that. And even right now, even at this distance right here, it really frames the face really well. You know, you guys can see that nice box right there. And before, you know, it was more receded because the doctor purposely made it so that it looked like I was a little bit receding. I didn't really like that too much, and that's one of the reasons why I ended up lowering the hairline just a little bit with added density. So that's pretty much it, guys. This is my day 56 review. If you guys have any questions, please make sure to leave some comments below. And I'll talk to you guys next time. Take care.